paused. Okay. 1 minute away from start time. So I'll just wait for you to tell me, Fiona, that we're recording, and then I'll make the introductory statement.
I've started recording, Fiona.
Thank you. I'll just wait for us to get to 2 o'clock. Quickly going to check if there's anyone waiting in the lobby.
Is this Richard's first meeting? It's your first meeting, Richard?
First one I've attended, yes. I give
Yes.
apologies.
Thought it was.
Yeah.
Right. Okay then.
Fiona, just to let you know that David Binney and Marlon McNeil are trying to get in just now. I have sent them the link, so they might just be a moment or two. I'm trying to call them in as well.
Thank you for that. Okay, we're at 2 o'clock. Welcome to this meeting, and particularly to Richard Williams. This is your first meeting, Richard, of East Lothian Integration Joint Board on 29th of October 2020, which is being held remotely in accordance with the Scottish Government's recommendations as regards physical distancing during the COVID-19 outbreak. The meeting is being recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. East Lothian Council, NHS Lothian, are the data controllers under the Data Protection Act 2018. Data collected as part of the recording will be retained in accordance with the Council and Health Board's policies on record retention, and the webcast of this meeting will be publicly available for up to 6 months. Would you like to begin the agenda, please, Fiona?
Thank you, yes. I'll begin by confirming that we've had apologies from Ian Gorman. And can I just ask, are there any other apologies he's aware of? No? Okay. I'll now proceed with a roll call of members present, beginning with the voting members. If you could indicate when I call your name, please. Shameen Akhtar.
Present.
Neil Gilbert.
Present.
Susan Kempson.
Present.
Fiona O'Donnell. Fiona, I know you're present. Patricia Donald.
Present.
Fiona Ireland. Peter Murray. Oh, thanks, Fiona.
Yeah, present, Fiona.
Thank you. And Richard Williams.
Present.
Thank you. And I'll now move to the non-voting members. David Binney.
Present.
Gaurav Chowdhury. Philip Connoglan. Lorraine Cowan. Richard Fairclough. Claire Flanagan.
Present.
Thank you. Alison MacDonald.
Present.
Marlon McNeil. I think Marlon must still be trying to get in. Thomas Miller.
Present.
Thank you. Judith Tate.
Present.
John Turville. Leslie White. Paul White. Thank you. And we now move to declarations of interest. Can I ask if any member has a declaration of interest on any item on the agenda, please?
No.
No? Thank you. We can now proceed to item 1, which is the minutes of the meetings of the IJB on 27th August and 17th September 2020 for approval.
Can I ask, the minute of 27th of August, are you happy to agree that as a true record?
Agree.
Agree, thank
Yes.
you. And the minute of the 17th of September. Now, what we will agree just now is the part of the minute, pages 7 to 14, which include the public business. So if I could ask if you're happy to agree those, and then we will, after the business has concluded with your agreement, we will move into private session. We will then approve the private part of the minute of the 17th of September and take any matters arising relating to that private minute. So in terms of the public part of the 17th of September, are members happy to approve that?
Yeah. Approved.
Yes.
Thank you very much. Next item, Fiona.
Thank you. The next item is matters arising from the minutes of the 27th of August and the public minute of the 17th of September.
Are there any matters arising that any members wish to raise, please? I'm not seeing any hands up. Okay then, happy to move to the next item, Fiona.
Thank you. It's the Chair's report.
Right, thank you very much. My goodness, it's the health and social care landscape just now is a very busy one. We currently have, you'll see in the agenda today, the review of adult social care, and both Peter and I have been involved with Jenny Cosla, and I think Peter, in your role as chair of chairs and vice chairs that you've also had. So we've got an opportunity today, and I hope every member will take the opportunity to contribute to the IJB submission, but also in your many other roles that you may wish to make a submission. It's a real opportunity to shape social care going forward in Scotland. In terms of the COVID-19 pandemic in East Lothian, we've had the news today from the First Minister that we will remain at level 3, but with an indication that alongside Edinburgh that we are on the verge of level 2. So I think it's really important that we continue to get that public health message out to people that now is the time for us to redouble our efforts, have in plain sight the opportunity to progress, to see our lives and jobs secured and our businesses opening up, and that we need to take that by redoubling our efforts to follow all the public health measures which are in place. We also had the publication of the report into deaths in care homes. And I really feel that it would not be appropriate to have the meeting today without making reference to that. The pandemic will go one day, but the scars and the hurt will remain for many. And I think particularly those who have lost loved ones who were living in our care homes. And I want to invite Alison at this stage just to make a statement. You, like me, may only have had time to kind of look at summary reports. And so Alison can maybe give a little bit of commentary in terms of East Lothian. Okay, thank you, Alison.
Okay, again, I would say, Fiona, that the actual report talks in general terms about national figures. There's very little that actually comes down to local level, but what does come down to local level is the number of people that were discharged into care homes awaiting onward care. Members of the IJB will be aware that East Lothian have been in the fortunate position due to some of the over the last in having discharge is delayed in hospital. So we had, especially in March, we were at a position where we were among the lowest in Scotland, if not the lowest. So we didn't have a huge requirement to move people through the system. So we were in a fortunate position that we didn't have a large number of people who were requiring care, waiting on their final destination. But saying that, there were some, but we haven't been made aware of any that are being made the subject of further investigation. So we're not aware of any that there are questions around. That's not to say there might not be something come up in the next months, but we're not aware of any that we've been asked to provide further information about. So members will be aware, as part of our mobilisation plan, we purchased, sorry, I'm getting a bad echo. We purchased some care home beds, and they were used not only for people whose discharge was delayed, but people in the community who whose care was starting to maybe become a bit more of a challenge to carers. So we almost used it like a respite service. So we used the care home that we purchased in Lothian in a couple of different ways. It wasn't all about delayed discharge. The other thing I would ask members to bear in mind is at that point NHS Lothian asked us to open Ward 5 at East Lothian Community Hospital. So we were fortunate. We were very, very fortunate in that we had a bit of extra capacity in the hospital system. So we didn't place a great reliance on having to purchase extra care home beds. So I think we found ourselves in a fairly fortunate position at the beginning of the pandemic that didn't necessitate us having a large number of discharges.
And I am going to invite at this stage if any member has any comment or question they want to make. If not today, then if this does make you ask questions about what happened in East Lothian, then please don't hesitate to be in touch and to raise those. But is there anyone who wishes to say anything or ask any question at this stage? No. And I think we should put on record, Alison, our thanks to our care home team and to all our staff in our care homes, both East Lothian independent sector as well, for their efforts, that it very heavily upon them, and thank them for the continued efforts to keep people in our care homes safe. Okay, well, Peter, do you wish to add anything as Vice Chair at this stage?
No, thank you, Fiona.
Okay then, Fiona, can we proceed to the next item of business, please?
Item 4 is the inclusion of IJBs as Category 1 responders.
Okay then, who's going to speak to this report, please?
I'm going to speak to this one, Fiona. It's Claire Goodwin.
Oh, great. Thank you, Claire. Go ahead.
Okay, so everybody will have had the report in advance and had a chance to look over it, hopefully. So I'll just go over it briefly and highlight the recommendations. So the purpose of the paper is to advise the IJB of the government's intention to make changes to the Civil Contingency Act to include IJBs as Category 1 responders. Just going down to the background, the Civil Contingency Act is the legislative framework for emergency planning in the UK, and there's specific legislation into. So two categories of responders are identified in the Act, Category 1 and Category 2 responders. Paragraph 3.3 explains who currently falls into these categories. IJBs currently fall into neither. If you go down to paragraph 3.4, that outlines the current responsibilities for Category 1 responders, which would apply to IJBs should they enter into that category. So I'll not go through them in detail, but basically the responsibilities relate to planning for and responding to emergency situations. Paragraph 3.5 identifies that although IJBs are not currently, don't have a formal role currently, they are involved in emergency planning and emergency response. The intention would be to change the legislation to formalise that role, so it would be giving them Category 1 responsibilities and also giving key responsibilities to the Chief Officer. Paragraph 3.7 identifies that the Scottish Government suggests we don't anticipate significant additional burden to IJBs based on this new Category 1 responder status. However, it does suggest that chief officers would be expected to draw on their resources from their integrated teams. If you can then just have a quick look at the two recommendations. The first one is just to note this intention on the Scottish Government's part. Recommendation 2.2 is that the IJB consider the implications of this intention, specifically to look at the implications in terms of financial, personnel and other implications, and these are contained at 8.1. Can I just apologise at this point for my error with 8.2? So 8.2 should read, there may be personnel implications associated. There's an opportunity for people to have an input today, but I would also invite people to get in touch with us by email in time for the end date of this consultation. So the consultation, in the paper it says the 2nd of November is the deadline. That's now been extended to the 22nd of November. So if we could have any comments by the 16th of November, just to give a few days to collate these ready for submission.
Thank you for that, Claire. I mean, it does feel like quite a lot for IJB consultation. We have to review the whole of adult social care and we have a pandemic. But I would appreciate if members could respond to Claire if you have any comments. It certainly seems on the face of it, given that councils, East Lothian Council, NHS Lothian are category 1, that it would make sense that the IJBs would also be at that level. So are there any questions or comments? Peter, I see your hands up.
Thanks, Fiona. Broadly, I actually welcome this. I take note of your comments, Fiona, that this is probably not as necessarily as welcome timing-wise, based on the other pressures that I'm sure Alison and her team are facing. But the general principle of this being an opportunity, I personally think that's what it offers. There are questions that I will pose perhaps more appropriately in my response to Claire, just to back or to hopefully help in the response that the IJB will provide. But for today, two key points that jumped out at me. One, a distinct advantage, which is the sharing of information. And I'd be keen to find out what the potential was and what the benefits were in that, because I don't immediately know what they are. And it'd be helpful at some point in the future, perhaps, to hear what they are, on the assumption this goes ahead. And my slight nervousness is the very point that Claire made around the expectation that Alison would find within our existing resource enough power personnel support in order to facilitate this. Because with all due respect to the various people that do work within Alison's team, it is a senior level response that will be required for the main meeting, and strategic planning and all the other aspects of what will be required by way of consideration won't happen itself. So I think there's a lot of consideration yet to be perhaps understood as to what the implications are from our perspective. Generally, I think it's the right direction of travel, but there's some unanswered questions about resource and other factors related to its implementation.
Thank you, Peter. And I think really through the pandemic that Alison and her team have behaved like category 1 responders. And I think we already have that community planning partnership in place, and where it now sits alongside that. And I'm sure that all the information required, but it maybe just formalises the kind of structure and makes sure that there's someone from the IJB in the room when these kind of decisions are being made. Paul, you wanted to make a contribution.
Yeah, thank you. Really similar territory to Peter's second point, that I think over recent years we've all been asked to do more with less, and we've got quite used to that. But I'd be concerned about, I suppose, the possible assumption from government that there's no significant additional burden. So I'd like to be satisfied that we do have the resources to do this. I know that colleagues are juggling a whole range of different agendas, and the pressure that the pandemic has brought on us has been significant. So I think it's easy to say that it's not a lot of extra work, but the reality for me might be a little bit different.
Thank you for that, Paul. And I think especially all the planning for a vaccine, which is hopefully not too far away, that that is taking up a lot of Alison's time, and she's the right person to be doing that work. But I just worry that more and more the demands we make of Alison and that her senior level of our management team, that it takes them away from the practitioners. So how will we take it forward, Claire, in terms of understanding what the impact will be? And I don't know, Alison, if this is something which chief officers are discussing to maybe have a joint response to the consultation?
I'll probably come in on that, and yes, nationally the chief officers together are having discussion about what it means. I think what I welcome the IJBs being at the table and being recognised as a partner in this. First off, I think it's a good thing. I think the other point that they make is quite right, that as a director of the health board and a director of the council, I'm involved anyway. You know, that's part of my other hat and my role. For me, the staff and the resources that the council and the health board direct or employ to deliver a response who are delegated to the IJB, to delegated services to the IJB. So for me, it's about tying up the fact that we are planning, and some of the planning and some of the directions that we have made to the council and the health board might not be possible due to some of the emergency planning that might have to happen. So for me, it's about how we tie up what the IJB's strategic thinking is around what staff should be doing and what we as a partnership should be doing with the harsh reality of responding to a situation that might arise. So I think I don't know the answer to what more resource will be required, but I think that's something as chief officers we're looking to tease out.
Thank you, Alison. Are there any other comments or questions? No? Okay, so please get your comments into Claire. Fiona, I believe we can agree the first recommendation because it's just to note, but we need a roll call for 2.2, is that correct?
That's correct, yes.
Okay, then would you please proceed to that? Thank you, Fiona.
Okay. Thank you. Can I just ask, first of all, for voting members to indicate their whether they agree for recommendation 2.1, which is to note the proposed changes to the Civil Contingencies Act 2004 in relation to the inclusion of IJBs in the list of Category 1 responders. So can you note your general agreement, please?
Agreed.
Agreed.
Thank you.
Agreed.
And recommendation 2.2 is to agree submission of a consultation response on behalf of the IJB by and it will be the revised deadline of 22nd November. The response will include the identification of potential impacts on the IJB, including any resource, personnel or other implications. And I'll now take a roll call vote. So when I call your name, if you could please indicate whether you agree the recommendation. Firstly, Fiona O'Donnell.
Agree.
Thank you. Shameen Akhtar.
Agree.
Neil Gilbert.
Agree.
Sue Kempson.
Agree.
Tricia Donald.
Agree.
Fiona Ireland.
Agree.
Peter Murray.
Agree.
Richard Williams.
Agree.
Thank you. That's recommendation 2.2 is unanimously approved.
Thank you, Fiona. The next item of business, please.
The next item is item 5, which is the independent review of adult social care, and I think it's again Claire Goodwin to present.
Okay, Claire.
Thank you. Diane's going to share my slides, hopefully. Just while we're doing that, Fiona rightly noted that the date for the consultation on the Category 1 responder has moved to the 22nd of November. And can I just ask if people could get back to us with any response by the 16th of November?
You can see the presentation. Thank you.
Great. Okay, thank you. IJB members will have already had a report on this topic circulated prior to today's meeting. There's also been a briefing paper produced by Paul Curry, and that's been circulated as well. So hopefully people have had an opportunity to have a look at it. Can I draw your attention particularly to the briefing paper, the inclusion of a set of questions that people may want to reflect upon to help them shape their response to the consultation. Okay, today I'm just going to do a very brief overview, so I'll give a bit of background to the independent review of adult social care. I'll give an outline of the focus of the review, and then we'll hopefully have a little bit of time for discussion. Although due to time constraints in today's meeting, the hope is that people will focus their energies more on providing a written feedback to myself or Paul, and there'll be more details about that later on. Okay, moving on to slide 1. Thanks. Okay, so the independent review of adult social care was announced at the start of September as part of the programme for government. A board for review has been set up and is chaired by Derek Feely, who was mentioned earlier in discussions, I think, as part of Fiona's chair's report. The aim of the review is to make recommendations as to how adult social care services could be improved in terms of outcomes for people using these services, as well as for the workforce delivering social care services. The phase that we're in currently is phase 1 of a 3-phase exercise. So the current phase relates to gathering stakeholders' views. As part of this, views are sought from people who use adult social care services, for families and carers, and from staff who work in these services. Local authorities, NHS boards and IJBs are also invited to submit views as part of this phase. The deadline for the current phase, which we're in just now, is the 6th of November, so fairly tight. As part of this phase, engagement with people who have lived experience of social care services is a high priority, and there's a national programme of engagement that's been delivered by the Health and Social Care Alliance, which is a national body. This programme has been promoted locally by Jane Alden-Smith with individuals and groups who've got an interest in adult social care services. Phase 2 will go on to develop proposals for changes and to look at possibilities, and it'll be based on the feedback gathered in phase 1. It'll also rely on reports from other sources as well, including some of the national bodies. Phase 3, which will take place later in December and into January, will look in more detail at potential funding, governance and regulation of new proposals, and the report will be produced by the end of January. So all very tight timescales. Moving on to slide 2. Okay, the review board has a set of terms of reference which outlines a wide range of matters for it to consider when forming its recommendations. So the next 3 slides that we've got today cover what the focus of the review is. So this slide really talks about the 2 groups of key stakeholders who will be focused on as part of the review. First of all, we've got people who have lived experience of adult social care, so service users, families and carers. This is a fairly extensive group when you look at the range of adult social care services that's covered, so ranging from care homes to care at home to day centres, day services and so on, and the number of people who are impacted is vast. Also looking at the adult social care workforce, again, this is a large body of people. A lot of people work in a wide range of services in different capacities with different employers, different terms and conditions and so on. Moving on to the next slide. This just highlights that the review is very, as well as having a very broad scope in terms of what it covers, it also is a very much a roots and branch approach. So it's looking at delivery of services and looking at different service models potentially, but also looking at governance, ownership, regulation, scrutiny and quality improvement. It'll also cover finance, procurement and commissioning. So a massive scope there. Moving on to slide 4. The terms of reference for review also identify that it should look at the the local context for adult social care services. So looking at local communities and the role of local communities and local organisations, and also taking into consideration current arrangements locally. I think the final bullet point there points to the potentially very significant shift in the delivery of adult social care that's being considered here, describing it as an opportunity to redesign the overall system. Moving on to the next slide. So, as I suggested earlier, we're inviting people to make submissions to us via email for comments and feedback, which we'll use to inform the development of a formal IJB submission to be submitted by the 4th of November. There's also an opportunity for individual IJB members to respond directly to the review board, and that's the email address there, and that's by the 6th of November. So we're asking for responses by the 4th in order to give us a couple of days to put something together. But if you're responding as an individual, the deadline is the 6th of November. That's all I'm going to cover just now, but partly because it is just such a wide area to look at. I know that Paul has also provided information to general managers and officers asking for their feedback as well.
Okay, thank you very much, Claire, and thank you for sticking to time on that. And I think there are two parts that people might want to comment on: the process as well as the actual terms of reference of the review. But just to encourage everyone's contribution is valuable here, even if it's just to pause and think, what am I going to want from services if one day I need to access social care services? So, those kind of personal aspirations that you may have could definitely form a part of this. It is a very tight time scale from talking about the people's experience of social care. It also looks at funding, which is a huge issue, which both at Westminster and at Holyrood and other devolved administrations, it's really difficult to address this issue because inevitably cross-party agreement is difficult to get, and it's such a difficult one, I think, politically, that it's hard for one party to kind of stand up with a plan if they don't get some cross-party agreement. So this is an opportunity for us as an IJB maybe to set an example to them, and certainly looking at what we think is a realistic funding model for social care. Okay, I've got Judith who wants to come in first. If anyone else has any comment on the content or the process, please just let me know by raising your hand. Okay, Judith.
Thank you very much, Chair. I think that this is timely that this is on today's agenda alongside the Chief Social Work Officer report. I suppose one of the concerns I have about it is that there's very little reference to social work within the language of this review and the terms of reference. And actually, I think it's really important to recognise the difference between social work and social care, when actually social work is really generally the gateway through which most individuals access social care support that's funded by the state. So actually, in order to ensure that social care outcomes and the services that are delivered as social care are the right ones for people, we have then a corresponding duty to look at how social work as a profession helps to facilitate and deliver that. So, and I think that is real across the whole range of adult care because of the dynamic relationship between people's lives and the whole range of services they may well require when they become vulnerable or in need. So I would, I suppose, request that when we are considering our response, we think about that difference between social work and social care and the importance of recognising it in this agenda.
Thank you for that, Judith. And I think it is I raised that point at COSLA, and I think it is really important, and perhaps it should have been a review of social work and social care. And I think at a time when social workers are under so much pressure during the pandemic and also integration, I'm very happy that we have Alison leading our IJB, but I think for social work, in terms of finding their place within the new system of integration, at times that's felt quite difficult for them, and this perhaps reinforces that message. The next person I'm going to call in is Peter, and then I've got Paul and Marilyn that I can see waiting. Thank you.
Thank you, Fiona. I just want to support Judith's comments there. I think it's a really important point that she's made. I think we should all fall behind that as much as possible. In the past, there's been some comment made that because I've got this slightly connected role of chair of chairs, that it's not fair for me to make use of that when I'm in my IJBs. But what I would like to do in order to try to address that challenge is to offer Alison and her team the submission that the chairs and vice chairs have made, and for her to then select from that what she thinks is relevant to our own IJB by way of comment. Because most of the comment that we've made, as you might imagine, is an amalgam of everybody's perspectives across the 31 IJBs, some of which, in fact, many of which will be relevant to what I would hope Alison might think relevant to our own contribution, particularly from a governance perspective. So that's what I intend to do, if you're agreeable to that, Chair, is to share that submission with Alison, and for her then to choose in yourselves which of the contributions we made from the widest perspective fit within the East Lothian assessment of where they would equally want to provide that response.
Thank you for that, Peter, and certainly if I can maybe just interject here, that I think as well recommending, and I think we have good partnership working with housing here in East Lothian, but I think that is essential. I think now as well we need better joined up working with the planning system. So, for example, that residential care settings should be at in the centre geographically of communities and not in the outskirts. And I know that's been a consideration with some more recent ones in East Lothian, and also having that misfit between planning law and what is in our strategic plan. Okay, I'm not going to say any more. Because you've been waiting very patiently. So Paul and then Marilyn. Paul White.
Thank you, Chair. Just a couple of brief points around process, and it's really about the timing and time for this review. So we may all welcome a review of adult social care. It's a challenging issue for us, but to have the review in the middle of a global pandemic with a relatively short timeline, and I'm not in favour of dragging things on forever, but it's a relatively short timeline we're working to. And the challenges that I think that raises for us is that it's incredibly difficult, even with the best efforts, to involve people with lived experience of care and support in this review. So if you can't visit a care home, or we're not able to visit people's houses or congregate in groups, then how can you assemble the views of people who might not be comfortable speaking online, who might not have the time and resources or the capability to send in written responses? So I think voices might not be heard. And it applies also to frontline staff in social care, that although they may find it a little bit easier to engage, there's certainly time pressures around that. So my concern is that we don't hear all the voices who are most relevant to this debate.
Thank you for that, Paul. And I share those concerns, and I think certainly in terms of the review board, while there are people on it with lived experience, there is no one there with the specific role of being a spokesperson or a representative for carers or for service users. And I think that was a big mistake right at the outset. Marilyn, you want to come in?
Oh, just actually this follows a bit on from Paul in that the last point in the terms of reference is models and redesign of services, and I assume a bit of a whiteboard in terms of vision of thinking and such. And we've got that process started here in terms of recommissioning, I'll say, of the care for the elderly services, but we haven't progressed anywhere near having an actual view that can come through from, and this also involves community input, which the terms of reference mention as well. So what do we speed that up? And I mean, it's almost impossible over the next, couple of months now to do that sort of process.
are you meaning in terms of our submission to the review, Marlon, or were you trying to talk about the actual provision of services for older people just now?
The submission to the review, because that would include presumably some models for provision of care to the elderly, and we haven't come up with the models yet in terms of North Berwick and Belhaven and Musselburgh.
Absolutely, and I think in that case, all we can say is that it's the world has changed now following the pandemic, and what what communities and what people are going to want. We have, last time I heard, 100 empty care home beds in East Lothian. So I think we are going to have to, someone's got the phone ringing in the background, could maybe mute.
That's me, I'll mute myself, sorry.
That's okay. And that, I think we just need to be honest about that community engagement, and also with representative bodies for older people, people with disabilities, learning disabilities. These are all important, but I think we just need to be honest and say that at this stage, we don't know what the social care landscape is going to be after this pandemic. So we shouldn't tie ourselves at this stage to any set view, but that view must be built and imagined in concert with people who are going to be using those services and working in those services very importantly in the future. But I think it would be wrong to rush to a review, to a view on that, to a vision, just because someone's, I'm not saying that's what you're suggesting, Marlon, but just because someone's asked us to make a review, a contribution to a review, we need to take the time to get this right, because where we started off, things are very different now. Do you want to come back on that, Marlon?
No, that's fine. I think as long as we know, somehow we indicate in our response to the review that we are trying to develop a vision to redesign the services here.
That's great, and we can maybe share some of that experience of needing to gather data. The data will be in a very different place, sadly, after this pandemic. But I think, yes, I think setting out maybe the work that we've done and what we think of the threads you need to try and weave together to come up with that vision. David Binney, I saw your hand up. Thank you for waiting, David.
Yes, thank you, Fiona. Earlier this week, Carers of East Lothian at their board meeting discussed this very topic, and I'm pleased to say concluded that they needed to make a formal response to this consultation. There then followed discussion about what the IJB might be responding in the consultation, and there was a school of thought that Carers of East Lothian would share their response with the IJB after it was submitted. But in fact, what we ultimately concluded was that it would be very helpful if the IJB were to share its response with Carers of East Lothian prior to the conclusion of the consultation, in order that Carers of East Lothian might seek to identify elements within the IJB's response and support it, which is a very long way of saying basically the same as Peter was saying in another kind of cascade down manner. But one interesting point came out during the conversation, which wasn't really a sort of carers point directly, but was one that the board thought particularly important. And this was the need to create a more sustainable and efficient workforce, and that creating a career structure within social care, a sort of proper professional career structure on an enhanced scale, was an important point that had to be made. Thank you.
Thank you very much for that, David. And Shameen, I see you with your hand up, and I promise I'm not missing you. But I also have a concern in terms of the workforce in the new world of self-directed support and personal assistance not being SSSC registered, and agencies which have them on their books, that there's no way of being able to look into whether someone, there's no way to complain for a start if you because there's no regulatory body you can turn to if there's a problem. So we raised that at COSLA as well. But while I know there will be nervousness that may push some people out of becoming personal assistants, I think it's really important that we professionalise that part of the workforce and also give them protection as well in their roles. Okay, Shameen.
Thank you, Chair. David's already covered it. What was chiming was that for East Lothian, we need to have a really strong emphasis of, especially because of our demographics, is on the workforce and sustainability of the workforce. And David, I completely agree with your points about recruitment and retention, and what Judith is going to cover in the workforce sustainability of social care and social work as a profession, and how we value it and support it, and how it's promoted as a positive career choice to make, and the potential for job opportunities and positive outcomes, especially from developing the young workforce. But I completely agree with you of looking at that in a strategic manner in the way that the government has done around the teaching profession, really supporting it, highlighting it's a good profession to go into. You have decent terms and conditions and support, but placing it with equal value with other professions.
Thank you, Shameen. And I welcome the idea of a national care service. I'm not quite sure what it is, but I hope it isn't about taking away local decision making. I think of our largest provider here in East Lothian, LCAP, and the innovation they have, and I think there will be lessons for the review to learn from their self-management model and what impact that has on staff when you see people applying in large numbers for jobs at LCAP, and what is it about LCAP that draws people to them, and that their care inspectorate reports are very complementary. So it's understanding from those local and smaller care providers what it is they do well and how that can become part of a national care service standards, but not stop and stifle that kind of innovation at a local level. And I think, Shameen, you're absolutely right about the demographics, but also the geography, that we face particular challenges in rural communities in fulfilling care packages, and the cost of transport, care workers not being able to afford a car so that they can get to service users in some of our more remote communities. And that I think needs to be addressed, that there needs to be some kind of top up in the funding formula which looks at the challenges of providing services in remote areas. Lovely to see your head nodding there. Thank you, Shameen, that encouraged me. And I have another hand up. I'm just going to wait and see if that's someone who's left their hand up or if it's a new hand up. Is there anyone else that anyone can see? All right, come in, Neil. Sorry to keep you waiting.
No, just to add to the thing you said about the National Care Service. I think a very important component of that will be at least a national living wage to go with the National Care Service. Is that something that, as an IJB, we could recommend if the consultation suggests it?
I think we should not only recommend it, Neil, we should draw their attention to the fact that we acted quickly in East Lothian to implement it. The last I heard, there were still, I think, 2 local authorities who hadn't. So I think, we should say that unless I get any dissent, that should be part of it, that we say that we fully support that, and that we should continue to improve and working in partnership with professional trade bodies and with the trade unions to improve pay and conditions for the workforce. So are members happy to agree? I was going to ask actually what the process will be clear for sign off of this as our submission. So is it just the case anything anyone says? I'm sure no one on this IJB is going to say anything awful that brings us into disrepute. But is that what we're going to do? Is it just that you will include everything, or is it going to have to be for sign off, or are we going to delegate that to perhaps myself, Peter and Alison?
Because of the timescales, so our submission needs to be in a week tomorrow, so next Friday, the 6th of November. So I wonder whether, sorry, if the best thing might be for it to come to yourself and Peter and Alison for sign-off. If everybody's in agreement with that, I think that might be a more practical way to do it.
Yeah. Can I ask for your agreement to do that with an assurance we won't take out anything that for any of us for any reason isn't comfortable. It would only be if there was something perhaps that mentions children's services because they're not part of the review. So it would not in any way be to censor the views of members of the IJB, both voting and non-voting. So are we happy to agree that? Fiona, maybe if you could give me some guidance on that, if I just need to ask if there's any dissent, or do we need to add that as a recommendation?
I think for clarity, it'd probably be useful to add it to the recommendations. Just inviting members to agree that that they're content with that the comments made today should be included in the response.
Yeah.
And do you want them to approve the format for sign-off as well?
Yes, please. I think it's in terms of governance, it's important that members have clarity in the public about how we're going to do this. And Peter, if you're putting your hand up to tell me you're going on holiday, I'm not going to be happy, but carry on.
I'm not going on any more holidays than anybody else, Fiona. What I was going to suggest was not only to support what you said there, but to actively encourage particularly non-voting members to say something about their respective roles within the IJB and how they feel that what they are able to contribute or not able to contribute, depending on the perspective, may impact upon the outcomes of this review. Because obviously they may have personal views on their own experience of adult social care, but they'll also have their own views on how the IJB functions within the expectations of delivering that. So if that wasn't already in the minds of those that are here today, my suggestion would be that they actively consider that their role within the IJB and any frustrations they might feel as a consequence of the way in which it's set up, that allows them to be influential in how adult social care is delivered.
Thank you for that, Peter. And David, I haven't forgotten your contribution about carers of East Lothian. I think it is important we find a way to share in advance of submission so that we can both note our support, because I think we have a good working relationship, and let's carry that on in this process. And just in terms of capturing just now Claire and Fiona in the minute, is I think as well the issue of capital investment in design of services is a big issue for us, that how do we actually construct the buildings and the homely environments for people to live in when council capital budgets and the process, a different process in the NHS for approving capital budgets, how do we address that so that we can move it a little bit more quickly, as Marilyn is right to kind of highlight that concern to see progress.
Fiona Richards been trying to get in for a wee while.
Oh, I'm so sorry, Richard. I'm now seeing you pop up. Please come in.
Not at all. Thank you. I'm just trying to clarify. I do appreciate the incredibly tight timescale, but are you suggesting that our response will incorporate all comments other than those that, of course, are disreputable? Because that, I suppose, gives me a little bit of discomfort, because not everyone must necessarily share those comments. So I might put in comments which might not be those of other members of the IJB, and yet it's going to be labelled as an IJB response. So I'm not entirely sure what the answer is, but I kind of feel we kind of need to see the response before it goes in. But of course, I
think that's a really good point, Richard. I think we might have well, would it be voting members only who sign it off, in which case there are fewer. But I wouldn't be comfortable with, I think what we could do is to frame it to say, these are responses which were received from members of the IJB. They do not necessarily reflect the majority or the view of any other member of the IJB. But I would not be comfortable just removing a response that was made by a member of the IJB. I don't know how other people feel about that, but I think if we put in that caveat that it does not represent the views, it's simply that we have pulled together the views of different members of the IJB, or is that a ridiculously idealistic approach to this? I'm happy, because I hadn't thought of that, Richard, and so I'm kind of responding on those. What do you think first, and then others can come in?
I think that's fair. I suppose also then would the suggestion be that we don't allocate comments to individuals? I think that probably wouldn't be helpful.
Yeah, I definitely think we shouldn't allocate them to individuals. Hopefully, yeah. Hopefully it's not going to be, but I think that may be the case. Claire, what do you think? I mean, should we try and find out if we can get all the voting members to agree, and then if there are comments which we do not agree, that we append these as submissions of IJB members who have not agreed to them, or do you think that it's going to be too difficult to get that round voting members in time?
I think we can certainly draw up a response that identifies any commonality from members, but also identify where it's an individual response, not naming an individual, but so the difference between a majority and a minority view on something. Paul Curry, who is in the meeting, has got a lot of experience of submitting consultation responses for the IJB, so hopefully he'll be able to provide a bit of a lead on this. In terms of getting it round people for them to look at and approve, if that can be done in a very tight turnaround, then I guess that it would be with the understanding that even if we say we circulated it at lunchtime, people got back to us by the end of the day, that kind of timescale, I'm afraid.
Yeah. Okay. I think then, Richard, I think you have made a valid point, and as I'm thinking about this, I think we should get voting members to take a position that this is the view of the IJB, the submission. I think then it carries more weight. If there are any views which are put forward that we don't agree, then we can add those as appendices. I think we need to know now, we need to tell the voting members, this is when you will receive the draft submission, so that people are looking for it in their inbox, and then they know the time that they have to respond as to whether or not there are any areas they don't agree. Peter, I know you've got your hand up, but that's a proposal I would like to put in terms of the process going forward. Sorry, Fiona, I realise in terms of for you finalising the recommendations a bit fluid just now. Peter.
Yeah, I know it's difficult, and I thank Richard for raising it, because he has raised an important point, but I can't see the problem with just having all views, and perhaps with the caveat that where a number of people have made the same view, that we indicate in some way the strength of the response without necessarily giving it a figure or a number. And as long as we don't give a name to individual responses, I see no harm. In fact, I see actively encourage personally that everybody should be able to say a comment on an issue that's relative to them, whether it just be one person or not, because the upshot of it is that they could, if they were minded to, provide that response as an individual anyway, because there's no distinction made about who can respond and who can't. So if, for example, we've got 6 people saying something about one particular subject, we could simply weight that in the submission by way of the wording used, and do that throughout all of the various submissions that we get, but don't discount or exclude any individual response, and just say these were a collection of responses that were received from different membership, because you would anticipate that people will have very different experiences and desires to comment on different things. That's to me the value of the IJB. Yeah,
I mean, I'm absolutely determined. First of all, we're not going to spend longer talking about the process and the substance of this review, because that's something that's far too common. I think we do need to take a view from the voting members. I think it's important to say that this is what we support, and then if there are other views outside of that, we have those within the report, but note that these are not the views of the voting members of the IJB, because I think there is a possibility that someone will have a vision of what care should be, which is not one which fits with our directions or that we would support as an IJB. So I'm aware, Paul and Claire, that your hands are up. I'm really keen that we progress this at this stage. And I think if we agree that broad principle, then the rest of it we can work around. So the recommendation would be that the draft submission is circulated to voting members to agree which submissions should be in the name of the IJB, and any other submissions by non-voting members would be included in the report, but noted as, and then some terminology, as appendices. That sound okay? So we'll take that recommendation. Thank you. Richard, first meeting on the ball.
Fiona, apologies. Could you just repeat that, please, for me?
Oh, no. Right, okay. So the recommendation is that the draft submission will be circulated to voting members of the IJB for their agreement. Any individual submissions which do not fall within that remit will be appended to the submission. Okay.
Yeah.
Thank you very much, Fiona. Okay, Claire.
Just to say something about timescales, Fiona, because you were asking when people would expect to hear something. So I was just looking at my calendar. So the deadline's the 6th of November, which is next Friday, and we'd asked for responses by the 4th of November, the Wednesday, to allow us time to collate something. If we have responses by noon on the 4th, we could aim to circulate something in the afternoon of the Thursday the 5th. And then even if we submit it end of play on the Friday. But what I'll do is I'll put that in an email to send round to IJB members just to clarify.
That's brilliant. Thank you very much. Thank you for your patience with that. Fiona, do you now want to take us to the procedure to end this item of business? Thank you.
Okay, thank you. Okay, the recommendations are at 2.1. The recommendation is to note the independent review of adult social care currently underway and to agree to develop a formal IJB response for submission by the deadline of 6th November. And this recommendation, because it involves agreement, will require roll call vote. Recommendation 2.2 is to invite individual IJB members to provide comments to the planning and performance team, as stated by Claire, to inform a coordinated submission on behalf of the IJB. And 2.3 is to note that a future IJB development session will focus on the implications of the review for delegated services. And there's also an additional recommendation, which will also require a roll call vote, which is to agree that a draft submission will be circulated to voting members of the IJB for their agreement. Any individual submissions which do not fall within this remit will be appended to the submission. So for clarity, and I think for ease, what I'll do is I'll invite members, voting members, to indicate in a roll call vote whether they approve all recommendations 2.1, 2.2, 2.3, and the additional recommendation of 2.4. So I'll come to you individually, and if you could please indicate whether or not you agree the recommendations. Fiona O'Donnell.
Agreed.
Shameen Akhtar.
Agreed.
Neil Gilbert.
Agreed.
Sue Kempson.
Agreed.
Tricia Donald.
Agreed.
Fiona Ireland.
Agreed.
Peter Murray.
Agreed.
And Richard Williams.
Agreed.
And just for confirmation, can I please confirm Fiona O'Donnell proposed the additional recommendation, and can I have a seconder as well, please, just for the note?
I'm happy to second it.
Thank you, Sue. That's fine. It's just for the record. Thank you. We're happy to move on to the next item.
Yes, Fiona, what I am going to say though in advance of this, it's 3:05. We have the Chief Social Work Officer's report, and I really want us to have a good piece of time to do to that report from Judith. So if I could just appeal to officers, if we presume we've read the papers, if there are papers relating to further items, so that we can make progress, please, and have time for that report. Thank you, Fiona.
Thank you. Item 6 is the social care sustainability payment update.
Okay, I think that's me. Thank you. Okay, I will be very quick with this, and I hope members have had a chance to look at it. But we thought given some of the challenges that have been around that we've been managing on behalf of the IJB, it was important to report back on the sustainability payments that have been made to our partners in care home and care at home. So it was a very quick run through in the form of an SBAR. Since the beginning of the lockdown in March, we have been supporting local social care providers by ensuring that reasonable additional costs are made through using the national principles that the Scottish Government have provided us with. The first and second tranche of funding has been provided through the NHS boards. We've had the funding through NHS Lothian. All claims are considered weekly, and we have a sustainability panel which is chaired by myself and attended by the Chief Finance Officer and procurement staff from East Lothian Council. To date, we have approved £750,477.20 to be precise in payments, £151,701 in additional costs. Now that's to cover the costs, for example, the main thing there is that care homes and care purchase over this period, and £598,775 for reduced occupancy in care homes. So it's not an insignificant amount of money that has been paid out. And I think the thing I would like the IJB to be aware of, that we initially contacted when we were given the instruction around sustainability, we made initial contact on the 24th of June. And we've given each provider individual support to work their way through the process, because it's not been without, it's been quite complex, and we have had to ask for evidence of invoicing and orders, and we've been back and asked questions about different things. And to date, 30 providers have responded and 16 providers have received payments. Of the 14 who have not, 2 don't intend to make a claim, 7 have yet to submit a claim, 4 claims are under review, and only 1 claim has not been approved. As well as support to care home providers on the National Care Home Contract, the panel have been supporting non-framework care homes in the same manner so that they can submit claims for service provision. The sustainability panel has also been subject to an internal audit by East Lothian Council, with the senior auditor attending the meeting on the 24th of August and reviewing our processes and paperwork. His initial feedback from the internal audit, the initial feedback from the team has been very positive, and a full report will be available to the IJB in due course. The partnership will continue to work in collaboration with our service providers to provide the necessary support as and when required and mitigate associated risks. I would highlight to the IJB that I think heading into a period where we're not clear what the sustainability payments will be, we're very conscious that the winter could be a difficult time for a number of our providers. But I would commend my team under the direction of Laura Kerr and who have made exceptionally good relationships with all our providers, I think, and have a really good working relationship So we're very hopeful that we will get early indication of any of our providers who may be experiencing difficulty, and then be able to get into discussion with them to see how we can help. So really, that's all I wanted to say. It is a significant amount of funding. We do have the money that has come to us for that. We have audited procedures, and it's really just for the IJB to note the content of the report and what we've done with the funding up until this point.
Right, thank you, Alison. I mean, I was a wee bit concerned that there were 7 still submit, one that clearly hasn't made their submission in the right terms, and you know, when I think when care homes are under so much pressure dealing with everything else, that having to submit this is, I think it's a shame that it wasn't an extension on the date to give them time to get through the winter maybe, but to know that they could have that in the back burner, knowing that they still had access to that fund. The one I wanted to ask about, Alison, was the social care staff support fund. I just think it is so important that is extended.
My understanding is that it's going to be extended, Fiona, but I don't have any detail if that's absolutely correct. So that is my understanding, but we haven't been given any detail of that as yet.
Thank you very much. Are there, Peter, you want to come in, and then if you could raise your hand or even wave at me if you want to speak. Thank you.
It's just a question how the reduced occupancy payments are worked out. Alison, is it some kind of average from previous years?
No,
or how they determine?
That's actually the easiest thing for us to do, Peter, because we actually have the occupancy of the care homes.
Right.
So we can go, in actual fact, we've gone back to care homes and said, we think we should be giving you money and you've not put a claim in. Okay. So we know the number of beds in the care homes, we know what the average occupancy is over the 3-month period prior to the pandemic. So from that perspective, that's been a really easy part of it.
Yeah. How does it work with private homes then? Because their costs are higher.
It's 80% of the national care home rate, so it's not. Right. It's not based on the levels that the care home set. So the sustainability principles set that all out. So it's 80% of the national care home rate.
Thanks, Alison.
Thank you very much. According to my screen, there's a hand up, but when I scroll down,
Laura,
right. Thank you, Laura. I couldn't see.
It was just to reassure you, Fiona, that we're very confident that Andrew Main, who's dealt with a lot of this process, has been very supportive of all the care homes. And as Alison's just pointed out, for some of them gone back to say, look, you need to apply for this. So I understand the difficulties for care homes to apply and all the other things they've got going on just now, but I think really confident of the process that we had in place and the support that we were able to offer our care homes.
Thank you very much, Laura, and for your input. I think we should try and maybe get into the habit, and I've not said this to anyone else, Laura, so it's not because you're the first, but that when people speak that they say what their role is, because for someone like Richard who's new to the IJB, just to, otherwise you'll be here 2 years, Richard, before you kind of work that out possibly. So yeah, if people would say their role as well when they speak, that'd be really helpful. But thank you for that, Laura, and for all your efforts. Okay, Fiona, do we want to proceed now to... Do we require a roll call for this one?
No, because it's just to note the recommendations in the report. So if I can just invite members to indicate whether or not they would give their agreement in general terms to the recommendations.
Agreed.
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 Thank you. Move on now to item 7, which is the financial update for 2020-21, and it's Claire Flanagan.
Okay, Claire, thank you.
Hi everybody, thank you, Chair. So I'm Claire Flanagan, Chief Finance Officer of the IJB, and I will take your point, Fiona, and be quick in giving this update. So this is the financial update to the board, and it gives the IJB's year-to-date position and the most recent outputs in terms of our financial forecast and undertaken by both partners, which is a snapshot as at month 5, so the end of August 2020. But also, as part at the end of the report, provides the IJB with a longer-term financial forecast in the shape of a 5-year rolling financial plan. It's worth pointing out this is an iteration pre-COVID and will be defined as is known and reported back. As reported in September, the financial position is not straightforward to report, and our finance teams in both partner organisations continue their work to determine the financial position, both in terms of our core operational activity, the impact of COVID-19 on the position, and the mobilisation and remobilisation, and then also the extent to which these costs will be covered with funding from Scottish Government. East Lothian IJB's year-to-date position, so as at the end of August, was an overspend of 1.78 million, and forecasted for the year end as a result of the most recent work undertaken by the finance teams is a projected overspend of 4.8 million across all the IJB's delegated functions. It is a deterioration from the last finance report, but isn't unexpected. And it is worth noting that it is predominantly COVID related that is driving our position. That is not the normal financial position we would normally be reporting. As previously reported, the IJB has received Scottish Government funding of 1.4 million, and at this time it's been used to support the requirement of the HSCP to support external providers through the sustainability principles developed by COSLA and SG. So that funding is being used in the first instance to support the report that Alison's just talked us through. More recently, a further allocation of funding has been received from Scottish Government, and £78 million has been received by NHS Lothian. This has been based on all our local mobilisation financial returns that we submit into Scottish Government. The allocation is split between 60 million for the Health Board and 18 million across the 4 Lothian health and social care partnerships, and it's to support both health and social care. I'm now in the process of working with finance colleagues to understand this allocation and what this means for the 4 individual partnerships. It's taken a bit of time to take the totality of the allocation and drill it down into the individual components. The forecast of 4.8 million is broken down in the tables, and it's worth saying that the position will continue to be monitored to better understand all the different elements impacting this, and I'm hopefully that the next finance report we have, the COVID funding will actually be included in the position, so this should improve our financial position in year and also our projections. In previous years, the IJB produces a longer term financial plan, and work had started on this pre-COVID but had been paused given the complexity. What I've provided in this report, as I think the IJB should have this information, is the financial plan for the next 5 years pre-COVID. We will refine this, so it should be seen as a bit of a work in progress and will be redeveloped when we have clarity on future service provision in a post-COVID environment. I thought it was worth taking you through the financial challenges facing the IJB. So Table 3 gives us the income and expenditure assumptions for the next 5 years. Worth noting, year 1 this year mirrors our latest projection in the paper and will improve once the COVID funding received has been included in our financial positions. It's also worth noting that the financial gap starting next year at roughly 4% and increasing up to 10% in year 5. Based on the information we have to date, Tables 4 and 5 then look to break down the income being received by the IJB from our partners, and it's based on the indicative information we have or flat cash assumptions in year 4 and 5 from East Lothian Council. The expenditure assumptions use 1920 as our baseline, and then they work on any local cost growth information we have or use the Scottish Government's medium-term financial framework for health and social care. And paragraphs 3.11 to 3.13 explain this in a bit more detail. There are financial challenges in the future, and a refinement of this financial planning assumptions will be undertaken. I don't think we need to make any rash decisions at this stage, but just to ensure we need to monitor this position and the requirement to ensure best value and use of resources and balancing our financial position in the future. And I'm happy to take any questions.
Thank you very much, Claire, who's our Chief Finance Officer. Wanted to ask Claire, in terms of the 5-year projection, does that take into account the kind of demographic projections that we have for East Lothian? So it's not kind of predicting on the basis of the population we have now?
Yeah, what we've done in projecting, particularly around social care, is we project a demographic increase, and I think I'm just going to double check my paper before I quote the wrong percentage, but I'm sure we've included a 3% demographic uplift.
Right. I think anything that you know, it's bad enough, and I appreciate you saying we don't need to rush to any decisions at this stage, but I think it does kind of set out the kind of challenges, even if it's a worst case scenario we could be facing. And I think that needs to be part of the submission as well to the care review, is that we need to start having conversations with people about their expectation of health and social care services and what realistic care is going to look like given the financial pressures post-COVID. I'm going to bring in Shameen first, and then I can see, Peter, you've got your hand up as well. Shameen?
That's great. Thanks very much for your report, Claire. It's just to focus on 3.5, which is around the additional funding. And you mentioned in there that the Scottish Government has issued a methodology for allocating that funding across the health boards and the partners. Are you able to say at this stage, is that methodology going to help us or hinder us in East Lothian?
So, so that methodology, what I was referring to there is the methodology as to how the letter, the value that came into NHS Lothian was calculated to be £78 million. That it's it's complicated, so it's a bit of a combination of covering your actual costs. So whatever we've put in our financial returns to Scottish Government, they've taken some months whereby they've covered 100% of our actual costs, and then there's some other areas whereby they've used an NRAC allocation. So actually you maybe have included, for example, you're going to spend £1 million in staff in the ward in the community hospital, but actually we're only going to give you an NRAC share of that funding, which is something that we are looking to see how that impacts on impacts of all the 4 partnerships once we drill down. I think as much as it seems a large amount of money, I think because they have taken that methodology whereby they've used NRAC for some things and actual costs for other things, I think there will likely have to be a future allocation in future months, and Scottish Government have referred to that there's likely to be another funding allocation potentially in January time.
That's good to have that clarification, because that is slightly worrying, and it sounds like we'll need to wait until you drill down to it. But the fact that we've got this kind of combination of NRAC and then looking at what your actual recorded costs are, because it seems to me your costs, you've been so rigorous in keeping that it'd be nice to think that would just be those are the costs. Shameen, do you want to come back in?
No, thank you. I think if that's the cost, that's the cost, and I don't understand why, if you've got the cost, you have to wait further on down the line to have it covered. And I think looking at our projections, they're not good. In looking at the financial projections, that we would want as much of that as possible. Otherwise, it makes it more difficult for us in future years.
Mm-hmm.
Yeah, and we often lose out through NRAC because we're not rural enough, but we're also not got high enough concentrations of deprivation to kind of benefit from that. Peter.
Thank you. Just a quick question, Claire. In the last table, the very last table on page 41, there's a figure against housing grant, disabled adaptations, and garden aid, and it's in under non-recurring, but yet it recurs every year.
Sorry, Peter, what paragraph are you referring to?
Page 41.
41.
Housing grant, disabled adaptations and garden aid, 1.494 million has been allocated against it as non-recurring, but then it recurs in 2021-22, again in 22-23, and so on to the very end.
This is a slight anomaly. This is part of our delegated budget from East Lothian Council, but it doesn't sit within our adult wellbeing operational budget, so it doesn't really sit neatly within the adult wellbeing budget that's the IJB's budget that sits within the council. So it is something whereby we have to add it in non-recurringly year on year, as a bit of as much as it appears year on year, it is non-recurring, and it's basically, that's also how the council allocate it to us, which is why we mirror it in our financial plan. It is an area whereby actually there's maybe something around assessing whether that should actually be delegated to the IJB, because it does give us some technical accounting challenges on the council side. So there's kind of informal discussions happening at the moment, just in terms of actually what does that really add around giving that budget to the IJB.
Yeah, I think, yeah. Also, I remember with the community alarms as well, that these things sometimes just complicate you being able to sort of close the books off. Have you got another question, Peter?
No, that's fine. I appreciate it. It's not easy, but the information's been helpful.
Thank you very much. Anyone else, any questions or comments? No? Okay, Fiona, over to you then, please.
Thank you. I think the recommendation is that we note the contents of the report. I'll just double check that.
That's correct.
Yeah, the IJB is asked to note the financial forecast, to note the work ongoing, that additional funding has been received but it's not yet allocated to partners, and the ongoing uncertainties, and the pre-pandemic medium-term rolling 5-year financial plan. So if I could ask members to indicate their general agreement, please.
Agreed.
Agreed.
Thank you. And we can now move on to item 8, which is the Chief Social Work Officer Annual Report for 2019-20, and it's Judith Tate to present.
Okay, Judith, over you, and you could maybe just explain the slightly different process this year in terms of it coming to us before Council. Thank you, Judith.
Thank you very much, Chair. I'll do that and start in that way. The Chief Social Work Officer Annual Report for 2019-20 was on the agenda for Council on Tuesday of this week, but due to the length of the agenda and the need to conclude the meeting at a particular time, Chief Executive asked for that to be deferred to the next Council meeting in December. So having looked at the statutory guidance, we concluded that there was nothing to preclude the report being on the agenda for today to be considered by the IJB. It has been submitted to Scottish Government in a draft form, and it will be discussed at Council in December. So on that basis, it's been agreed, and Alison was content for us to go ahead and have that on the agenda for today. So I'm very pleased to be able to present the Chief Social Work Officer Annual Report for 2019-20. The report fulfills a statutory requirement for the Chief Social Work Officer to produce a report on the activities and performance of the social work service in East Lothian. There was also, just to note, a briefing for elected members earlier in the month, so some of the key messages have already been shared with some members that may well be here today within the IJB. The report is not intended to be exhaustive, but gives an indication of trends, priorities, challenges and opportunities over the past year. This year, in recognition of the impact of the pandemic, the Scottish Government has asked Chief Social Work Officers to focus their reports on a number of key areas, and those form the basis of the chapters of this report. The role of the Chief Social Work Officer is to ensure the provision of appropriate professional advice and to promote the values and standards of professional social work practice in the discharge of the local authority's statutory functions and with an integrated arrangement. It includes all social work services for younger and older adults, justice social work, and social work services for children, young people and families. My role is to assist local authorities and partners in understanding the complexities and, importantly, the cross-cutting nature of social work service delivery, including how it to adult protection, the management of high-risk offenders, corporate parenting and child protection. It also highlights the key role social work plays in contributing to the achievement of a wide range of national and local outcomes. The Chief Social Work Officer also has a contribution to make in supporting overall performance improvement and management of corporate risk. So, whilst staff and managers across services are firmly focused on managing current demand and anticipating the future shape of social work and social care services will look like through the lens of COVID, it's important to acknowledge the range of work undertaken during the first 11 months of the 2019-20 reporting period, and we have much to celebrate. We've been working in partnership with people who use services to improve those services. There have been positive findings and positive learning from external inspection and scrutiny, and we have been developing capacity for self-evaluation, assurance, and leadership. There's been a stronger focus on facilitating the conditions and solutions that will enable adults and children to remain living within their own home communities. And there's been increased capacity for early intervention in targeted services. As the pandemic continues to evolve, the focus for social work and its key partners is becoming clearer. And that centres around the cumulative impact of COVID across a number of domains in people's lives, namely mental health, substance misuse, poverty, violence against women and girls, carer stress, managing the increased demand for social work and social care services. We need to maintain a focus on human rights and representing the voice of vulnerable people. A focus on achieving how we're going to achieve the pace and breadth of changes required within and between services for renewal, while still in response mode. And at the same time, grasping the opportunities provided by COVID things and working together differently. We need to maintain the focus on sustaining meaningful human contact and relationships in what is, of course, a relationship business with people who use services within a working context that is largely virtual for a lot of what we do. We need to achieve a safe balance between change and stability for the workforce. And there's a national change agenda that's upon us already, as we've heard about today, with the review of adult social care and the findings of the independent review known as the Promise. And these will shape how public services will work together to keep vulnerable children living safely within their families rather than within a public care system. Our staff have worked incredibly hard to meet the challenges of fulfilling the social work task within the context of COVID, and I want to express my sincere thanks and appreciation to them publicly for their commitment and dedication to improving and protecting the lives of the most vulnerable people across our East Lothian communities. I would like to thank my colleagues in the Health and Social Care Partnership Management team for their support in collating information for the report, and to Trish Carl for her role as lead social worker in adult services and my de facto Deputy Chief Social Work Officer. I hope the report will stimulate discussion and assist IJB members in understanding the value and the nature of our social work services within the integration of health and social care. I've managers on hand, hopefully, to answer any particular questions that I don't have all the detail about, but I hope you've enjoyed reviewing the report and reading it, and I look forward to the discussion.
Thank you very much, Judith, and I'm pleased that your report had its premiere at the IJB, and thank you. And I think we cannot underestimate the strengths which working under these kind of conditions remotely has put on your team. It really is. Social work is all about engagement, and that is increasingly difficult to sustain, and supporting people who live sometimes very chaotic lives or are vulnerable. So thank you very much. So I did submit a number of questions in advance of the council meeting, which Judith has given me replies to, but I might put some of those kind of in the public domain. I think if members have any questions or comments, please raise your hand. And the first one I wanted, I'll maybe just kick off with, Judith, is about our capacity in terms of mental health officers. If you could update us, because we've had some extra funding from Scottish Government, but I wonder what our capacity is just now. And then I'll come to Richard and then Peter.
Okay, yes, I can. I know that Trish will be able to come in to support this, and Rona probably as well. So the partnership has already committed some additional funding to increase capacity for mental health officer functions. And we did get funding for one additional MHO from Scottish Government, but unable to be completed this year because of COVID. So we will kind of take that forward into next year. However, I do believe we are still reporting around about a 50% under establishment, which, let me say, is not unusual. And this is an issue and a concern across every local authority area and all partnerships. So we know we're in the process of confirming funding to recruit an additional MHO before the end of 2020. And we are recognising some of the ongoing increase in demand coming with Adults with Incapacity Act. So it's very much on the agenda for managers. I'm aware of that, and I think the whole changes to the structure, the management structure, and moving the MHO function across into, another part of the management arrangements to give it a particular focus is really in recognition of the importance of that. But I will ask Trish or Laura to come in. Trish, maybe first, just to add some more detail to that.
Okay, Laura, do you want to start?
Oh. Well, I think Trish is going to come in. I think that covers it quite well, Judith.
Right, thank you, and congratulations to the member of staff who completed the training.
Yes. Okay. So yes, we have always taken a proactive approach to growing your own mental health officers in East Lothian. So we've always worked very hard to support applications from within our social work capacity for training. And we usually put one person each year through the course. And obviously that has financial implications because we have to backfill. And then obviously want to consolidate their practice, but then we also have to wait for a vacancy to come up to enable them to be appointed into. So we work very proactively to try and increase capacity wherever we can. As Judith indicated, we received an extra £34,000 this year to promote additionality, which means that we will be looking to potentially send 2 people next year. The money will pay for the backfill in terms of funding. Look to send 2 people next year on the mental health officer training. We, again, through kind of good housekeeping and budgeting last year, we were able to recruit a full-time post, which was recruited to back in January. Again, through kind of housekeeping and kind of change in circumstance, we currently have a 17.5-hour vacancy, and we're looking to how we can build on that vacancy to enable us to offer a full-time post to the successful this year. Still think we would need another 2 mental health officers due to the demands of the Adults with Incapacity Act and to grow capacity in the service for succession planning, maternity cover, etc. But we also are kind of looking at the way we working differently. So in terms of kind of refocusing on what is the statutory responsibility of the mental health officer and of that service, and looking at what tasks currently that we undertake that may be kind of delegated to social workers as opposed to mental health officers. Along with that, we're realigning our mental health officer team into the statutory services. And again, we're hoping that will create some capacity to support the kind of growing demand.
Thank you very much for that, Trish. Richard?
Thank you, Fiona. Firstly, obviously, it's an excellent and comprehensive report and clearly addresses all the areas of significant responsibility and accountability. Perhaps, if I might though, suggest there's one small area, or maybe not such a small area, that hasn't been touched on, I don't think, and that's to do with sustainability and environmental impact. Paragraph 1.2 says that the report is to encourage debate and discussion around the IJB's directions. And I wonder if that's something that we might want to consider in future, is that directions include a comment or request that the services we're directing do demonstrate, a minimising environmental impact and sustainability.
That's a really interesting point, Richard, and certainly East Lothian Council has declared a state of climate emergency, and that's very much a growing trend across Scotland. But you then need to enact that and show how you're enacting that. So Judith, would you be able to pick up on that, or is that something you need to go away and think about?
Well, I think it's a very fair point. I think this year's report is a shorter, truncated template. So you're right in pointing out there will be some gaps. There are some areas we've not covered that I did last year, and I think then the challenge will be for us to reflect on your point in our preparation for next year's report and think about whether or not that's forming part of our considerations as much as it should do. So I suppose thank you for prompting me with that, and we will consider where that kind of sits and fits, although I see that Trish wants to come back in on that. Trish?
Yeah, just to say, I think the report in 2020-21 will be very differently, and will begin to very much kind of address some of those issues. Obviously, we have significantly over the past 6 months. So I think that will contribute hugely to in terms of that agenda, and also the kind of the increased focus on digital inclusion and digital provision of support. So I think next year we could very easily have quite a comprehensive section in the report that reflects that contribution.
Yeah. I can certainly think retrospectively of things we've done or you've done, which would contribute to that. But in terms of being proactive and actually how that underpins, runs as a golden thread through everything we do, that it's maybe something worth taking to a development session where we can hear reports on what are we going to do to play our part and minimising the impact of the services we provide on the environment. Anything else from you, Richard?
No, that's very helpful response. Thank you. Great.
Thank you. Okay, Peter.
Yeah, thank you. Can I start by sharing Richard's comments that I enjoyed reading the report. It was very helpful and enlightened me in a number of areas, so thank you for that to the team. Also, I want to acknowledge on page 70 the particularly good trajectory of the days from referral to allocation. I think that should be acknowledged. So just to make that point. But specific questions, I hope they're not too difficult, Judith, because my mind is sort of moving for strange ways when I read these reports. But I'm looking at your table where you've got the number of hours that have been allocated and you've got the number of reviews. I think it's on page 64. And the reviews in 1920 were 1,416, but the number of home hours delivered was reducing year on year. Well, not quite, that's not entirely true, but certainly it was reduced from the year before. Is that a more efficient and effective review process, or is that financially driven?
I'm going to ask my colleague Laura Kerr to comment on that. Laura?
And yes, I will comment on that, and just reflect on what Fiona asked earlier. I'm the service interim general manager for service improvement and strategic planning, so I have oversight of the quality assurance required for all our commissioned services, as well as a number of other things. So in relation to the hours, I need to do some work on these hours. I think your point, just to be clear, when the reviews are done, they are reviews of quality of service. So it wouldn't necessarily be that somebody's hours would reduce. It may be that they increase or in fact remain the same. But what the review team were there to do, and that's what you're seeing reflected in those hours, is that some of that will be as a result of packages being reviewed, outcomes being met, and therefore care can cease. The reduction in the care hours is a combination of things, one of them being simply the capacity is reducing. Alternatively, it is also looking at there are other ways that we are delivering on some of the always care at home. So I would like us to be given the opportunity to just go back and do a bit more digging into those numbers. We're currently doing that under the Care at Home project board to look at how we can improve capacity as well as the efficiency within our Care at Home service. So I don't want to look at too deeply into those numbers, but they're not, the reduction is not about saving us money. The reduction is about potentially there's not the capacity there to deliver care at home. Sometimes care at home is not the service that's required. And yes, the increase in reviews does often mean that we have a reduction in the amount of care at home that's required because that is being recycled or alternatives are being sold.
Okay, thank you.
I realise that is a really difficult one to entangle, Laura, but looking at different types of service models, also community capacity to support people that maybe doesn't need a statutory service. I think that's something we see real potential for during the pandemic and seeing the resilience groups and communities.
Yeah.
Peter, sorry, carry on, Laura.
I think as we get better at reporting, what we want to look at is not focus on hours, but our focus on whether people feel their outcomes have been met, and that would be a better reflection of how we're doing, as opposed to how many hours we're providing. But we're not quite there yet, but we are working very hard on it.
Peter?
And that's at the heart of my question. That's the exact point that I was trying to draw out. That it doesn't necessarily mean that it's a negative. If the assessment is made on what the level of service is and how that's received by, sorry, I've got some real puppy management issues going on at the moment. So I'm trying my best. She's just been a little monkey. Yeah, my other question is, it relates to, again, a challenging question perhaps, but what's the further potential for more integration, do you think? Particularly, Judith, on your earlier comment that you felt that perhaps social work and social care are misunderstood, and because it's an integration theme that we're all here to try to assist in its passage to more effectiveness, are there areas you think that we've still got some latent potential in?
I mean, my comments were, I suppose, not a reflection of East Lothian in terms of its commitment to integration in any way, and I think that our kind of, you know, the kind of continual refinements, I suppose, of the management structure and opportunities we're taking, I'm saying we, on behalf of the social work service partnership and partnership management group, to find the best and most effective ways of bringing services together, you know, really underpins that commitment. I think publicly there is a confusion about social work and the difference in social work and social care, and I think that as a profession there's a need to remember that whilst it's the two are symbiotically linked, there's differences within it. So I think there will always be more opportunities for integration, and I suppose for that to be really meaningful and balanced, then I think we have to constantly strive to make sure that the different professional roles and tasks are fully understood and respected across all the different working groups. So we have you know, allied health professionals, health professionals, social work professionals, social care professionals. What's really important for integration is that everybody really understands and values each other's contributions, because there are some things only some people can do, and there are other tasks that a broader group can do. And really, that from my part, the best forms of integration will be based on, you know, true understanding and respect of each other's roles, where you can come together and where some of those roles need to be separate. Great.
Yeah, thank you. It's a very helpful answer. Thank you, Judith.
Thank you. Okay, and now I've got Marlon. Marlon is the user voice on the IJB. Marlon, over to you. And then
thanks, Fiona. This may be my lack of knowledge, Judith, but obviously from the area of meeting, food poverty, especially child poverty, is the major issue that they've been trying to deal with and coming up with innovative ways and such. But I'm wondering, does social work have a role in monitoring this field? And is there any capacity, is there enough capacity to be able to provide support and direction to agencies such as in the community, such as the area partnerships?
Okay, that's an important point, Marilyn, and I think given the most recent publication of the increasing levels of child poverty and poverty within parts of our communities, it's something that we have to remember, that when we think about East Lothian, it has a different story, a different picture from other local authority areas, because we have areas of affluence and we have some areas, they may be small, but for which, as you know, poverty that echoes that in much more urban areas. So the role of social work in terms of poverty is, it's absolutely at the heart of soul of what it is that will contribute to people being vulnerable. What is less clear is what the role that social work has in mitigating poverty or in helping to prevent it. So I think it's an area that we have to work very much with our partners in. So I know that the Poverty Action Group and the Child Poverty Action Plan that is led on within the council services, within Power of Estuaries service area, is being reviewed, and certainly the Children's Strategic Partnership is taking forward the of the Child Poverty Action Plan. So there is a link, but as a targeted service, Children and Families Social Work sees the results of poverty, but it is less got a responsibility of it within universal services. So an important point, and we are acutely aware of it, but I would say that the biggest responsibility probably sits within communities and partnerships, and sits within the community planning partnership arrangements for reducing the impact of poverty, rather than social work specifically.
Thank you.
And I think we've seen a lot of initiatives, Marlene, those of us who live in East Lothian, to tackle especially holiday hunger, but when children weren't able to go to school, we were getting free school meals. And I think it's so important that we make sure that we're joining up all those services, that there's no duplication, but we're not missing anyone. And we have a food network in East Lothian, and that seeks to kind of make sure that no one's being missed out. But also the council in its budget had separate funding to support holiday hunger clubs, to make sure that children in the holidays. But I think there's some really good work going on across the county over the festive period to make sure that families are getting that kind of support. Tricia, do you want to come in this? And then Paul, I'll come to you.
And just to say that there's a strong interface between the partnership and the council in terms of kind of some of the initiatives. So through previously the work around supporting people who are shielding, and kind of more latterly support in terms of isolate and support through the test and protect. So there is a strong interface with the partnership and a safety net in terms of through social work for delivering support across East Lothian.
Yep, and for social work, we'll often refer on to agencies like the Food Bank, the chicken dinners, things like that. Paul, and then Shameen.
Thanks, Chair. Judith, really enjoyed your report. Lots of great achievements in there, and quite an education reading through it. I was going to focus though on a challenge that you identified, and that was in relation to adult support and protection training. So I saw that for understandable reasons, the training in 2021 had been postponed, so we'll all get why that is. But I see that the move is proposed to online training. So I've got two questions. One online training platform coming along, and the second is, will that training be open to independent and third sector colleagues as well as our public sector colleagues? And the reason I'm particularly interested in this is that with COVID-19, people will become less visible because of the restrictions that we're required to live with. And therefore, I think the worry for many of us is that it might be more difficult than normal to pick up on harm to vulnerable adults.
Thank you very much, Paul. Yes, good questions. The IT platforms, this takes up more than my time than I would like it to, and I think we have a commitment from East Lothian Council is moving to be able to use Teams, Microsoft Teams, which will give us a greater interface with other public services. So I think that the kind of pinning our colours to the Skype mast was, I understand why we did that, and that it has facilitated good internal communication. It has given us some challenges in terms of our partners because the police can't access that. So I think that by the middle of next year, we will be on the same platform as more public services and hopefully more third sector services. Because the public protection training programme is part of the joint East and Mid Lothian Public Protection Committee, we have access through Mid Lothian's IT resources to, kind of jump on those and make use of the facilities that they have. So, I mean, staff are working very hard to find the best and secure and most stable way of being able to reach the most people. Your point about third sector, absolutely. My understanding is that should be and will be, and actually we have to make sure that people who are not in the office as much as they were, therefore not chatting to other colleagues about something that might be niggling them or concerning them or something that didn't make sense. When there are not as many eyes on staff as there were before, then we have to actually find other ways of allowing them opportunities to challenge their thinking and prompt their thinking when they might be faced with an adult, who isn't behaving in the way that they think is right, or they have got concerns about. So an important point the Public Protection Committee is acutely aware of.
Thank you.
Thank you, Paul. Shameen, are you still here?
Yeah, yes, I am. Thank you. I think first of all, just to acknowledge the phenomenal amount of work you and your staff team do, Judith. Just looking at the number of referrals that you have this year, over 8,000, and how that's been increasing year on year. So it's a phenomenal amount of work in supporting some of the most vulnerable people in our community. And please pass on our thanks to all of your staff team for that. But as part of integration, you may want to come back on this question. One of your key challenges for recovery is the rising incidence of domestic abuse. And as part of integration, and I know you've mentioned lots of different things that are happening within the department on raising awareness of that issue, is there anything else that IJB could be doing to support that effort to tackle the increased levels of domestic abuse?
I think that in East Lothian we have that for understandable reasons, because we became a joint public protection committee, the Violence Against Women and Girls Partnership, that's where that sits within the public protection arena. That's the kind of sharp and pointy end. That's the response end of domestic abuse, and it functions very well. And I think we have a really good service there for people who have experienced domestic abuse that we know about. Where the strategic driver for how you reduce the incidence of domestic abuse sit, I think, is the question, and it's one that I'm taking for discussion at the Community Planning Partnership, and I know that Trish and colleagues are raising the awareness of within health and social care, to say what other aspects of our work can we strengthen the kind of strategic approach to reducing it and minimising it, because actually it's continuing to grow in East Lothian. As unpalatable as that is, it is so good enough for us to looking at what our response is. We have to say, what can we do to prevent it? How do we create a zero tolerance? How are we a zero tolerance employer? How do we make sure our staff are fully understand the zero tolerance to this? And what are we doing in our engagement with communities to promote the violence against women and girls agenda? And actually, that's all looking at the negatives. The positives are around equality. If we were promoting equality from children up to adults, we would have less violence against women and girls, I would argue. So gender equality and opportunities to give people a voice are really what's going to be at the heart of reducing domestic abuse. There's a long lag in that, but I think those are the questions I'm urging my council colleagues to be considering, and I think they're relevant for every service across the piece, whether it's roads and infrastructure, whether it's the health and social care. I think we all have a role in reducing this and being able to talk about it quite openly.
Yeah, thank you. No, I agree with you. Absolutely agree with you.
Thank you, Judith. And I'm so pleased you mentioned within that young people and the role of education in educating the next generation to know what abuse is, and to understand that is our approach is zero tolerance. And certainly the Community Justice Partnership, there was an interesting discussion with our partners around those very themes. Are there any other questions? Not that I can see. Okay, I wonder if I could just come in with one more, Judith. First of all, to thank you and your team for all the responses and all the work that you do. But there was highlighted in the report from the Care Inspectorate at Abbey home in North Berwick, about the excellent work there of staff to ensure that residents were able to exercise their democratic rights. So I wondered, is that something which we're ensuring is happening not only in all our own care homes, other services for older people, and in the independent and voluntary sector as well?
I consulted with Margaret Drew, who's the service manager, who assured me that the good practice that was demonstrated in the inspection of the Abbey certainly will be shared amongst our own independent, our directly provided services. Whether we have as you know, Fiona, limited capacity to impact sometimes on the way that private providers manage other services. So whilst we have opportunities for care home managers to come together to discuss shared issues and concerns, we would hope that they would pick up on the findings of inspections from other services. And I know that Matt Kennedy's team does a huge amount of work in terms of kind of promoting good practice in terms of kind of the kind of the social care for residents and how that the kind of the rights and choices of residents are promoted, and that comes through very strongly, certainly in my observations from my role within the kind of care home oversight group that's running at the moment. So I would say that we do well at sharing things that work well and are important in people's lives, but what you're highlighting is a very important point. Within the current restrictions and the pandemic, how do we ensure that people's rights and choices are being maximised and optimised? And it's an extremely difficult balance to strike between ensuring people are safe and that there is good, safe infection control management arrangements, and ensuring people have as many choices and have the rights to make decisions about their own lives as possible. It's a very difficult circle to square, but one we need to continue to make sure we have the conversations about.
Great. Well, hopefully the Lothian Joint Valuation Board will be promoting the uptake of postal ballots early and plenty of time for any forthcoming elections. Right, thank you very much, Judith, and for everyone for excellent participation in that report. Fiona, do you want to take us now? And we just have to agree, general agreement. We don't need a roll call for this one, do we? And then
no,
if I could just...
No, we don't, sorry.
Right, and if I could just ask members that we will need to go into the private session, so just to pause while Mary, and hello Mary from the Courier, is able to leave the meeting, and then we'll just finish off very quickly that final part of private business. Okay, Fiona?
Can I just to indicate their general approval of the recommendation to note the contents of the report?
Agree?
Happy to agree.
Thank you. And that takes us to the last agenda item, the minutes of other groups of relevance to the IJB. The agenda, which was circulated electronically, contains links to minutes of the Audit and Risk Committee and the Community Justice Partnership, and these are for members to note in their own time. They're all available on the Council's website.
Okay, thank you very much, and thank you, Sue, for all your work as Chair of Audit and Risk, and Trish, we look forward to working with you in the future. Okay, so are we ready now then, Fiona, to move into the private business?
Yes.
Right.
I'll just double check. I think Mary's left, hasn't she? Yes. I think we can stop the recording. We don't need to record private business.
Good, because I definitely think, sometimes when you have a particularly grim news